There is no way to predict when a donor liver will be available, so the transplant team must be able to reach you at all times. Make sure your transplant coordinators have contact numbers for you, your family members, and any other primary support people. Make sure your voicemail is set up and working. You must let us know of travel plans, especially when you're close to the top of the waiting list. And tell us if there is any change in your insurance coverage. Another important responsibility is to know before your surgery how you will get to Baylor. Sometimes a donated organ must be assigned very quickly. The faster you can be reached and get to the hospital, the better. You must not be more than a 6-hour car ride from Baylor. It is very important to know how you will get to us and who will bring you. While you wait, your hepatologist will work closely with your local doctors to keep you as healthy as possible and get results of your routine blood tests. These blood tests are very important to keep your place on the waiting list. This is also a good time to review your finances to determine what your deductible and copays will be and how they will be paid while you're in the hospital. You want your care plan to be fine-tuned when that donor liver is found and the call comes.
When I got that call, I was scared, and literally, honestly, I actually told my husband, what about if I give it to the person that's waiting? And he's like, no, he's like, you've came this far. He goes, we can't go back.
As soon as a donor liver is available, you'll get a call with specific instructions. That call could come on a holiday, in the middle of the night, or any time at all. It cannot be scheduled at your convenience. So you need to be ready, especially as your MELD score gets you closer to the top of the transplant list. Know where to go and what route you will take. Also be aware the nurse calling you may be using an unfamiliar number or a blocked caller ID. That could be the call you're waiting for. Answer it! There's a chance you'll be called to the hospital and sent home because the donated liver was not suitable. Or you could be called in as a backup recipient and also sent home without a transplant. Think of these as dry runs, as a dress rehearsal for the real deal. When you are called, you will need to get to Baylor quickly. Once you get to the hospital, your current medical condition will be checked with labs, tests, an EKG, and chest x-ray. You may also be offered the choice to be in a research study. Baylor is involved in many national studies. If you give your consent to be in a study, you may be able to get new investigational medications and treatments before they become generally available. A typical liver transplant operation takes about 4 to 6 hours. As soon as the transplant is done, your surgeon will tell your family how the operation went and how you're doing.